I wanted to ask the panel about the Sinovac vaccines. Essentially, could you please tell us why Singapore received shipments of the Sinovac vaccine before the HSA's authorization for use, especially given for the other vaccines that Singapore did receive shipments arrived at least a week after HSA's authorization? Is part of the issue the fact that Singapore potentially was unable to turn down perhaps the Sinovac vaccine because it wanted to avoid potentially upsetting Beijing?
Well, ask DMS to provide some more greater detail, but essentially we have a supply contract with a supplier for Sinovac vaccine. And as part of the contract, the delivery was made to deliver, I think, 200,000 doses to Singapore. And we take the delivery, we allow the delivery to arrive, but we do not yet allow the vaccine to be used because we haven't approved the use. HSA hasn't approved the usage. And HSA continues to discuss with the supplier to get more detailed data to allow them to make adequate full assessment. So I think that's the situation. The key is because we do have a supply contract, and when the contract, under the contract, the delivery is made, so we take the delivery, but we do not allow it to be used for the time being, pending approval from HSA, and HSA is in the process of reviewing it, but they are still pending additional data from the supplier.
Just before DMS clarify, I just wanted to perhaps clarify the timeline that you talked about and the comparisons made with the other vaccines, because in fact it's not quite what you just described, was not exactly accurate, because we made advance purchases for all three even before any approvals were made. We said that, I think, late last year, right? Before approvals were made, there was a committee looking at the whole range of vaccines that were available, and we said that we were making advance purchases in a way, in putting some bets in some vaccines, recognizing that some of these vaccines may not turn out to be effective, but we wanted to be able to do so early so that we would be relatively early in the queue and would be able to get some vaccines in for Singapore. So that was the basis in which we went about making these advance purchases. It was only after the purchases were made that the companies started completing their trials, submitting data, and then they were then subject to HSA's approval. So that's actually the timeline and the process. And as far as the HSA timeline is concerned, or the HSA process, I think DMS can elaborate further.
Yeah, and also, just before DMS, the fact that we take delivery also allow us to roll it out faster once approval is given, rather than to have to wait for delivery again. So I think that's the reason why we also took delivery for the first lot.
Indeed, to extend the comments made by both co-chairs, we did make advanced purchasing agreements with these three vaccine manufacturers sometime last year. And this was, in fact, before the completion of all phase 3 studies associated with these vaccines, and before other regulatory authorities had given their approval for these vaccines. The advanced purchasing agreements included a timeline for when these vaccines will be provided, and based on that time frame, these vaccines would be delivered to Singapore by the manufacturers. In order to shorten the process by which approval would be done, and to allow vaccines then to be administered to the population, starting our vaccination campaign, the Health Sciences Authority designed a pandemic-specific approval framework that allowed for data to be submitted to the authority as it was available. There was no need to wait until all the data was in and to then submit that as one complete package, and they could submit this in tranches to allow for work to be done to start that evaluation process early. There's no compromise in the process of evaluation, but these little tweaks to the system allowed for evaluation to start early and then allow for the full process of assessment to be done before approval then is granted. And it so happened for both the Pfizer and Moderna vaccines that the data had been submitted in a timely fashion, and it allowed the Health Sciences Authority then to grant approval soon after or just before these vaccines arrived on our shores. And therefore, there's a perception then that the approval came and the vaccines then were delivered in short order. But in fact, this was based on a time frame that already had been planned for and committed to under the advance purchasing agreements. With the Sinovac vaccine, the delivery of the vaccines, again, was based on the purchasing agreement. There was no coercion, there's no influence by other bodies, and this has been a commercial, contractual agreement with the manufacturers themselves. Unfortunately, in the data that had been submitted, and the manufacturer had endeavored to adhere to Health Sciences Authority's approval framework and try to give data in a timely fashion into the authority, they hadn't submitted a complete package of all the data that was necessary to complete that evaluation process. So the Health Sciences Authority has gone back, asked the manufacturer for more information, and in the meantime continues to evaluate and process the data that's been submitted to date. But until that additional data is submitted, the Health Sciences Authority will not be able to complete its evaluation process and therefore would not be able to give its provisional approval. And until that approval from the regulatory authority is obtained, we will not be using the Sinovac vaccine, even though it's arrived in our shores, because we want to assure all Singaporeans that the vaccines have been fully evaluated, deemed to be both effective and safe for use before we actually use it in our vaccination campaign.